My name is Walter Chow. I've been in family medicine for the last 25 years. I have a practice of about 2,000 patients in Victoria, British Columbia. We initially thought that it would be too big of a task to take on to convert all of our medical records onto an electronic form, but actually the process was easier than I thought. And what we decided to do was run a parallel paper and electronic medical records until the transition was complete. One of the concerns we had initially was whether electronic medical records would distract from my job of practicing medicine, but actually we found the process much easier than expected. And I think in a few short months, we realized that we could not do without an electronic medical records and would never go back to paper. Electronic medical records has made my practice much more efficient. We used to have a huge volume of paper flow that would come into the office. I would have to read those paper reports, and then my receptionist would file them into each individual chart. So it meant a lot of work for me. It meant a lot of work for her. And now I can dictate a referral letter to a specialist, attach lab records, attach my clinical notes, attach my thoughts, and often that is done before the patient even leaves the office. One aspect of family medical practices has changed significantly over the last few years is the development of chronic care and complex care initiatives. And this means that we track patients longitudinally over a course of time with respect to their chronic medical illnesses. It serves as a great way for me to be able to monitor patient care over a long term. And it also is a great teaching tool because patients can visually get an idea of how their chronic care is being managed. Prior to the implementation of our Access electronic medical records, we used another software program for scheduling and for billing. And the natural thought was just to add on electronic medical records to that process. And we looked at the various vendors, we realized that Access really had the premium product. I think in contrast to other products that were added on electronic medical records afterwards, Access was built as an electronic medical records from ground up, so we found it was the most comprehensive package that we could find. I think another thing that drew us to Access was the excellent support that we had in terms of training and ongoing support. I would definitely recommend the switch to electronic medical records. It's a little bit of a daunting process to think about switching from all of this to electronic medical records. And what's behind me now essentially is for shelf decoration because we didn't want, just bare shelves to look at. But after about 6 months, we realized that there was absolutely no way that we could go back to doing the things we did before. Our practice is much more efficient. It's just immeasurably better than it used to be. It's freed up more time for me to practice medicine, what I love doing. It's freed up more time for my staff to do what they love doing more instead of the menial task of managing paper rather than managing patient care.